IOE 413 Health Systems Modeling Study Guide. This question is about healthcare value. And the fundamental value equation is the following. Value is quality divided by cost. So quality can have multiple dimensions. And it can be actually the desired outcomes of some sort of intervention, say improved mobility if you're treating somebody with an orthopedic condition. It can also be safety. You'd like to have a safer healthcare system that would be higher quality. And patient satisfaction, the higher the satisfaction, the higher the quality. So there's multiple dimensions of quality. And they can be measured different ways. And what this question wants you to do is come up with a metric that measures value for infant mortality across countries. You want this metric to be such that a higher value is good and a lower value is bad. This table illustrates the data that we'll use for this problem. It lists some information for the United States, France, Germany, Japan, the United Kingdom, and Canada. What it presents is both infant mortality and healthcare expenditures. And infant mortality is expressed in the number of babies that die per 1,000 live births. And the percent GDP is the percent gross domestic product that's spent on healthcare. So what the question wants you to do is develop a metric in which larger numbers are good, higher value, and lower numbers are bad. You'll notice a couple things here. That here in this column, infant mortality, a higher number is bad, and a lower number is good. Just the opposite of what we want for the healthcare value metric. So we're going to need to change this somehow to come up with a healthcare value metric that makes sense. Now, there isn't just one metric you could use. I can think of several. I'm going to just choose one that's pretty simple and show you how it works. And we'll then fill out the healthcare value measure on the right. So the value measure that I am dreaming up for this problem is going to have in the numerator the number of babies that survive. The more the better, right? And so that for the United States, for example, we had 7 babies die per 1,000 live births. So the number that survive will be 1,000 minus 7. And then the percent GDP in the U.S. that's spent on healthcare is 15.3. So a ratio there ends up being 64.9. That's our healthcare value metric based on infant mortality in the United States. So this is the first part of Part A of this problem, because Part A wants you to come up with a healthcare metric that makes sense, in the sense that a higher value is good and lower value is bad. And the second part of Part A is to fill out those numbers for the complete matrix given the data that was presented. So let's do that now. So this is the complete table with the rightmost column filled in. And this constitutes the answer to Part A of the problem. Now Part B wants you to examine the table and see which country has the best healthcare value and which has the worst. Well, let's look which one has the highest healthcare value. It would be 124.6, which is Japan. So Japan, by this metric, has the highest healthcare value. What's the lowest? Well, let's look down. And the lowest here is 64.9, which happens to be the United States. So the United States has the lowest healthcare value of all the countries listed in this table. And that's the answer to Part B.